Hi, and welcome from Scottsdale Veterinary Hospital. This how-to video is about subcutaneous fluid administration for cats. So if you're watching this video, your veterinarian has probably prescribed subcutaneous fluid therapy for your cat. This is a great way to assist in hydrating your cat when dehydration has occurred, often due to decrease in kidney function. Breaking down the word subcutaneous, we see that sub means under and cutaneous pertains to skin. So as you may have guessed, subcutaneous fluids means fluids under the skin.
Now, depending on if your cat is in early or late kidney disease, or perhaps they're experiencing another condition that may require them to have fluid therapy, it may be prescribed as a daily treatment or perhaps 2 to 3 times a week. So always defer to your veterinarian's recommendation for your cat. This video is only used as a tool to explain some tips on how to properly and effectively perform the SubQ fluids, not meant as any prescription from us to you. So always defer to your veterinarian's recommendations on this topic. So many owners do ask, why does my cat need fluids under the skin? I do see them drink water all the time. That may be the case, but it is important to know that the kidneys are the central functioning filtering service within the body. It filters the toxins from the bloodstream and helps to balance minerals within the body. And any waste products that get filtered by the kidneys get excreted out in the urine. So in kidney disease processes, the kidneys are no longer working at their full capacity. So toxins can end up building up more quickly within the body. And although cats may be apparently drinking more, they cannot drink enough water to help flush out those kidneys effectively. And that's where SubQ fluid therapy comes in handy.
Once you have a plan in place with your veterinarian, you have a couple of options. The first option is to come here to our clinic and have a veterinary professional administer your cat's subcutaneous fluids. This can be a little bit more costly, more time consuming, and more stressful for both you and your pet. The other option is to administer the fluids yourself at home, which this video will demonstrate how to do. At our hospital, we sell fluid administration kits that contain a couple of things. The first, like Amber is showing, is 1 full bag of fluids.
So we either give out saline or a lactated ringer solution, depending on what your veterinarian has recommended for your particular cat.
The other thing in the kit is 10 sterile needles, like this one Amber's holding, and also an IV line, which comes fully flushed and prepared, ready for you to use right away.
Okay, so the first thing you're going to want to do is familiarize yourself with the clamps along the IV line. So there's 2 different kinds. There's multiple clamps down the line. One is a pinching type of clamp, where it pinches off the fluid flow. The other is a rolling clamp, where it rolls down to occlude the flow of the fluids. So when we do send this kit home with you, you'll notice that we will have already clamped one of the clamps, just to make sure that it's not pouring out into your car on the way home. So you can take a look at those clamps and figure out which one has been closed for you. But all of them are effective at stopping the flow of the fluids. The second thing you're going to want to note is the amount of fluid that's in the bag. So when we send you home with a kit, we do send you home with 1,000 mils or 1 liter of fluids. And for most cases, we do recommend giving about 100 mils at each dose. So the top of the bag to the first line, this number 9 here, is going to be 100 mils. And the 9 down to the 8 is again 100. There is a line dividing the 2 of them, which would show 50 mLs of fluid in between. So it's good to keep an eye on how much fluid you've got in the bag when you're starting your administration, so that you know where to stop. The third thing you're going to want to notice is this little reservoir underneath the bag, and that's going to show you if the fluids are flowing or not. So once you unclamp the fluids, you'll notice that there's drips there of fluid dropping, so you know that you've got a good flow. The next thing you're going to want to familiarize yourself with is the needle that you're going to be using. So we do often send home a fluid kit that has a needle attached to it already. If it doesn't, there's likely going to be just a plastic cap on there. Now to disconnect the needle and place a new sterile needle on, you're going to want to twist one direction and secure the other direction to remove the needle. And it's the same to put it back on. So you just press it on there and slide the little cuff and twist it on so it's nice and secure. We do have a cap protecting the end of the needle because it is sharp, so do use caution when you're using needles. So once you're ready and prepped to go, I'll put a brand new needle on this for you. So it comes in these little packages. You just want to peel back the plastic to prepare it here. Remove the old needle by twisting it off. We want to keep these ends sterile, so try not to touch anything when you're working on that. And then we're just going to twist that onto your line, just like that. So now that we have a fresh needle on here, you can see it is quite a large needle. The reason we use a large needle is so that we can deliver the fluids quickly, so that it's a faster procedure for the cat. We don't particularly want to take too much time. So this needle that we're using, you might notice there's a bevel on the end here. When you're administering the fluids, you want the bevel to be pointing up, just like I've got here, so that the fluids can go in at a nice rate.
For most owners, we recommend having a family member or a friend to help out at first. It can be difficult at first to manage both the fluids with the needle and the cat, so having someone else to help can be really useful, especially when you're first starting out.
So once you're ready to administer the fluids, we want to make sure your pet is in a comfortable position and secure as well, so that they're not able to run away. We also want to find a place to hang the fluids. If they are elevated, it does flow much nicer. We don't want it laying flat on the table or anything like that. So in the hospital, we use a little IV pole, but at home, you can certainly use a nail on the wall or perhaps a coat hanger to hang it over a doorknob or the back of a chair. That's totally fine as well, just as long as it's elevated and that you can see the numbers on the bag to know how much fluid to give. So the next part you're going to want to do is find where you're going to administer the fluids in your cat. So it can technically be given anywhere under the skin, but for people starting out, we do recommend giving it in the scruff area because there's a lot of loose skin that you can manage there. So with your non-dominant hand, you're going to want to create a little tent of skin, just like that. Most cats will tolerate this motion quite well. If they don't, definitely try working on wrapping them in a towel, and we have a video link for that as well that you can certainly watch if you need a hand with that. So we're going to make a little tent with our non-dominant hand, and with our dominant hand we want to find a little entrance to the skin there. So we're going to go directly into the skin. We don't want the needle to be pointing down because that can go into the bone and muscle tissue. We want it to be at more of a 45-degree angle to make sure that the fluid is flowing nicely under the skin. So once we have everything prepared with our kit and a brand new needle on, we can even just practice the motions without giving the needle to start so that you kind of get the hang of how to do it. So you can make a little tent, find the entrance, this is where the needle's going to go. All right, so now that we're ready, we'll check where we're at on the bag. We know where we're clamped off here. For this case, we've clamped it with this little sliding clamp, and we're going to go ahead and administer that. So, our needle's pointed bevel up here. It's nice and secure on the line. We're going to find our tent, and then we're going to insert the needle just like that. So, some cats may flinch, others may tolerate it no problem, and others might try to be a little handsy or try to get away, which is why it's really important to have somebody here helping. So you can see now that the bag here, there's droplets flowing nice and fast. Depending on how the cat is positioned, sometimes it can change. Once you're finished administering the fluid and you've reached the point in the bag that you know you've delivered 100 mils of fluid, you want to clamp off the fluid line with one of our clamping devices. And then to remove the needle, you want to pinch the skin with your non-dominant hand while you remove the needle with your dominant hand. And we want to just keep that pressure there for about 30 seconds, just to make sure that the fluid doesn't drip right back out of the site of administration. During the procedure, if they are getting a little antsy, you can totally stop, clamp off your line, and come out and try again. It does take practice, and it can even happen to our staff here where we need to start over or give them a little break between fluids. For some cats that are very dehydrated or older, you may find that when you place the needle, it might poke out the other side of the skin. And if you do see some fluid start to pool, I would recommend stopping right away and starting again. It does commonly happen, especially with very dehydrated pets. So don't panic, it happens to even the professionals here. Once your needle is placed and your fluid is running, you might start to feel a little pocket of fluid under the skin that might feel a little bit squishy. That's normal, and it will sometimes take a little while to absorb into the body. So sometimes it even starts to sag into their arm, and it might look like they have a big muscle on their arm or something, but that will slowly start to fade over the day. Now, one thing that I wanted to mention is sometimes you might notice that the fluid is dripping very slowly, and that can happen if the needle is in a place where it's rubbing up against a skin barrier and it might not be as adequately placed. So you can just slightly direct the needle in a different angle just to see if that would help, and that may allow it to go a little bit faster for you. Now, sometimes when you're feeling for that fluid pocket, you might notice it feels quite tight. At that point, you may want to stop the flow of the fluids and change to a different position, and that can allow you to give a little bit more fluid in a different area instead of it being so tight and uncomfortable.
Learning how to administer SubQ fluids like this can take some practice, but if you keep trying, keep coming back to this video for advice, and absolutely talk to us here at the clinic if you need more. We know you can do it. So thanks for watching. We hope you subscribe to our YouTube channel and stay tuned for more how-to videos like this one. Thanks.